Hi, everybody. This is Charlie. This is To Hell and Back podcast. And you can see, if you are viewing this, you can see me alongside Andrea Gold. Many of you are not viewing this, so you'll be hearing us. But I have a guest today that's really, this is just a very important podcast with a very interesting and brave woman who's going to talk about something that's still ongoing for her. It's not like a past thing, but it is that she was diagnosed with cancer in January, and she's been going through treatments, and she's still going through treatments, and she still has uncertainty about what's going to happen. And so she's been having to call upon all of her resources, personally, socially, every possible way, to cope. And that's really what this is about. And as you know, if you've listened to this podcast at all, it's about coping with adversity in life and relying, part of that being to rely on DBT skills. But it's also just anything that helps us sort of continue to walk through hell when we're there, and to walk and to get out when possible. So that's what this is about today. So I want to introduce Andrea and then get started. So I just want to give you the briefest of introduction, because you're going to learn much more about her as we talk. Andrea, who I've known of for a long time, is a very active, engaged participant in the sort of nationwide DBT community in all kinds of forums, NEA, BPD, and the listserv and trainings. And she's a teacher of DBT. She's a student of DBT. She's a practitioner of DBT. She runs a program. She's the leader of a program at Bradley Hospital in Providence, Rhode Island, for DBT, especially a track that includes focusing on exposure for people who have OCD, but also are learning DBT skills. So it's very interesting. And she's also an assistant professor of psychiatry at Brown University, though she herself is a clinical psychologist. So that's really it, and we're going to get into the story of who she has been before she had cancer, who she is now, how that has changed her life, some of the details that she's gone through, though this isn't going to be a medical podcast exactly, but you can't escape that, and then how she learned about having cancer, and then how she responded to that, and then how things have unfolded since then, and what she's used to cope. So that's really it. So, Andrea, welcome to the podcast.
Thank you, Charlie.
Yes.
I am feeling right now what my daughter, her name is Olive, she's almost 6, which she described really captures my emotional experience right now starting this. We had just opened the pool last week, and she had been really excited about the pool, but also pretty nervous and anxious about swimming again after a long time. And she said when we were about to open it, so I see that as parallel to where we are right now, opening the podcast, opening this vulnerability. She said, "Mommy, I feel super excited. I feel a little bit nervous, and my body wants to wiggle." And so that, like she nailed it. Nervous and excited, and I want to wiggle. And I'm happy to be here with you.
Right. Oh, thank you for coming on. I think it's a remarkable thing to do. I know enough about you to know that it actually isn't that surprising that you would come on, because there's kind of a whole exposure lifestyle. You try to go into things that are hard and with passion, and be willing to do stuff. So I'm not surprised, but I'm very pleased, and I feel very responsible for us having a good conversation about this, so that other people out there who are coping with similar things can learn. And by the way, how old is Olive when you say?
She'll be 6 in September.
6.
And then my little one, who shares your name, Charlie, she will be 2 in August. So I've got 2 little ones.
All right, great. So, so if we get going into this story, first, just tell us a little about who you've been in your life, like where you live, how did you end up doing that? Just a little bit, not a long time, because that's not as much what people are interested in, but they need to know who you are.
Yeah. It's hard to even think about pre-cancer who I am, because cancer, I've read in different support groups that I'm on, like when you get your diagnosis, it's part of your life. There is no going back to the normal before. So I'm aware of that's going through this filter. But I can say that I live in Rhode Island, which my husband and I have been here now going on 5 years. And we've lived all over, and this is the place that we are calling home. I think it's a very special place, especially in the summer. I was born in New York, lived there till I was 9, Florida from 9 to 18. So it's weird to say where I'm from, because it was, before college, half and half. And I've always been somebody who is both very kind of colorful, excited, passionate about things, extremely extroverted and connected, and at the same time I can be shy and socially anxious. So I think that's really part of who I am, and how that's affected the social parts of my coping now with cancer. I've wanted to be a psychologist since I was 13 years old, and that did not change.
Wow.
And it started, I was reflecting on that recently. In middle school, my dad and I we lived in Florida at the time, we would do this Friday night kind of social, like, connecting thing, the two of us, where we'd go to Barnes & Noble bookstore. I'd be in my aisles, he'd be in his. At the time it was more vampire, young adult stuff, but I made my way to psychology and totally got hooked. And the book that actually, where I was like, I want to be a psychologist, is Girl Interrupted, which is quite interesting, because that's a memoir of someone with borderline personality disorder, the disorder where Marsha Linehan first studied DBT. And so I ended up going to college at Cornell in Ithaca, New York, which is also a very magical, beautiful place. Ithaca is gorgeous, with the waterfalls. And I met my husband through a mutual friend the year before I went to Cornell. So we have just celebrated in February, 2 days after chemo started, February 20th, we celebrated being together 20 years, which I'm quite proud of, being only 38 years.
Wow. Right. Only 38 years, and you're celebrating your 20th year. Congratulations. Yeah. Wow.
We've been married for 12 years, but I feel like we put in that time, so I get to also, I've earned the 20 years, so we celebrate both of those.
No, you've earned the 20 years. I mean, because you were married before you were married. I mean, I'm sure, and just the way people many times get married and divorced even in the same relationship. But formally you've been married 12 years. I get
what's
that.
interesting about that is that anniversary, it's funny how this worked out. The 20-year getting together anniversary was right when chemo started. Our 12-year anniversary is July 3rd, 2 days before my mastectomy. So it's interesting how we'll be celebrating at these different points in my treatment too.
All right. And so when, and I'll just say that I saw you in person right around the time that you had just been diagnosed, or you had just had a biopsy, right? So just to bring this up closer to the present, in January, we both attended the funeral service of a colleague about whom and with whom I did a podcast before. If anybody wanted to dig back through my podcast, Seth Axelrod, who was at Yale and who I think was a teacher of yours. And Seth had battled cancer, and he came on the podcast, and then his wife actually came on the podcast as well. And so we were both at his funeral. And then what I didn't know at that time, and you chose not to tell people at that time for obvious reasons, is that you had just discovered that you were being diagnosed with cancer. Is that right?
That's right, yeah. I met Seth in 2007, my first year at Yale. So that's where I went for my PhD in clinical psychology. And I was actually the only student in my cohort. I didn't have any classmates, which was an interesting experience. So my intro to psychotherapy was just me and the professor. So naturally, he had a lot of guest lecturers, and Seth was one of them. And so we met that day, and that's when I drank the DBT Kool-Aid and got hooked. And so for 6 years when I was at Yale, I did a couple years training intensively with him, and then a practicum, and we've stayed in touch since then. So he's been an incredibly, his family, an important person in my life, and really so much of what I get to teach and practice as DBT, he lives on in all of that.
Yeah. Yeah. Okay.
So he had passed away after battling cancer from he was diagnosed when I left Yale in 2013, and until he passed away January 25th of just this year. And it was the day before I learned that I have cancer.
Mm.
And the day after I learned that I have cancer was his funeral. And I told my husband not to go. I felt like I wanted him there. He would have gone otherwise. And at the same time, just learning your wife has cancer and then going to a funeral of someone who lost their life from it was too much.
Oh, man. Wow.
And there were a lot of people that I knew and cared about and loved that were at the funeral as well. And I wanted to share this with people because I knew from the start, part of my coping and living with cancer was being open and vulnerable and sharing. And that would be kind of fucked up to go to a funeral and say, steal the thunder and say, oh, I have cancer too. So I had kept it private at the time.
Just the very beginning of so many decisions you've had to make, like, it's just the decisions you weren't having to make up until that moment in your life. When you say cancer has become part of who you are, you must be making decisions on a daily and weekly basis about, should I do this? Should I do that? Should I take this path? Should I tell this person? How should I tell this? I mean, it just must be just frame everything you do in some ways.
It's thinking about weighing the short-term and long-term pros and cons for myself, and knowing that cancer prompts a lot of emotions in other people. Whether it's how they feel in relation to hearing cancer right now and in relation to me, or their own fears of cancer, that comes up a lot, or past life experiences they've had. And so it's making kind of calculations on the fly of what's effective. And I've tended, because of who I am, to be more on the open side, and also from witnessing Seth doing that and seeing it work for him. There have been times where I've done that and it hasn't been effective. And so I also have learned from that, kind of doing the best I can with the information I have available, and then recalibrating over time too.
So tell us what you found out. What was your diagnosis? Can you tell us a little about the illness?
I will. So I had first, this is important backstory because it affects my emotional reactions in this year. I had first discovered a lump in my breast in 2016 when I was in my first trimester with Olive, and that was scary. That was my first, time brushing up against cancer. I went to the OB. She felt it, told me to get an ultrasound, and at the ultrasound, the doctor had said, "This is nothing. This is dense tissue. Don't worry about it." Almost brushing it off, like, oh, I don't know why they had you come in. So that was a big relief. Then throughout the 6 years since I was pregnant with Olive, and now, that lump changed in size a bit. And when I talked to my OBs in 2020, I was pregnant with Charlie. Had shared my experience before the dense tissue thing, and they didn't do anything. They didn't make anything of it. So this year, so 2021, I had been breastfeeding Charlie, noticed the lump was still there, and realized that, this looks a little bigger. I should get it checked out. This coincided with a decline in Seth's health, and realizing that he was losing his battle to cancer, and that he was likely not to survive it. And I felt, I'm the kind of person where I'm not always motivated to do things for me, but I'm very affiliative and connected to other people. So if I could kind of trick my mind, a bit of a adaptive denial skill that we use in DBT. to do it. Oh, I'm going to do this to honor Seth. That will motivate me and push me. So in December, I think it was 2 to 3 weeks before I learned that I have cancer. I had seen an OB. She did the right thing. She said, you need an ultrasound, mammogram, biopsy, and see a breast surgeon. And I was like, well, this seems like a lot, but let's do it again. This is thinking I'm going to honor Seth, and that helped me do it. And I remember being really surprised when I then met with the breast surgeon January 19th, and she said, "Yep, you have a palpable mass. I can see it, and it could be non-cancerous, but it could be cancer." And I remember really like doing an uncertainty exposure and thinking it may be cancer, it may not, and being really surprised that it wasn't terrifying me. And I reflected on it. I shared with other people because there are other uncertainty things that come up in relationships where I'm like, I can ruminate about it or get stuck. And I realized, oh, cancer is not personal. Cancer is not rejecting me. Cancer just happens, so that helped. And I was shook by the news of Seth passing away. And I had been really expressive of my love for him over the years and more recently. And so in a way I was prepared. And of course you never can be prepared for losing someone you love. And I, on that Wednesday, the day after, it helped really to say, okay, I'm doing this for Seth. He would be glad I'm doing it. Really not thinking that it would be cancer and not thinking that I'd find out that day. And it happened very quickly. It came up after the mammogram, after the ultrasound, the radiologist who did the biopsy made it clear as much as she could. We cannot definitively say it's cancer without a biopsy. And this is, she basically said, this is highly suspicious. The speculations, the patterns indicate cancer. And I said, well, what if the biopsy says negative? And basically she didn't use these words, but the point was, well, we would consider it a bad test and we would do it again.
Oh, wow. Yeah.
A tech who was there knew when I started crying, and she was new to this job, but she came over and held my hand, and that made a world of difference. And then I had a biopsy, which is a painful procedure. And where it really hit me was in the car afterwards. My husband, I should share, Chris, is an ER physician, which I think has also really affected our experience and coping with this in many ways. And he was like, "Ange, did you mean to lose weight this past year?" And I had dropped 10 to 15 pounds in a month or two, November, December, without trying. And I was kind of excited, like, oh, well, I'm getting my body back after having a baby. This is nice. And, I learned the metabolic rate of cells with cancer go faster, and weight loss is a sign. And that's when I knew. I just knew, and it hit me. And so the next day was the funeral, and it was an unreal experience.
Andrea, how did you? I mean, you're very affiliative. It's obvious from what you're saying, and very concerned about people you care about. So you ask your husband not to come to the funeral. How did you go?
My little sister. So that was one thing. If it wasn't Seth, I don't know if I would have gone. It's the pros cons. It was something that if it was someone I wasn't as close to, I probably would have put myself first and not gone. And I knew I wanted to for Seth, but for me. And I called my sister. I asked her to come because I needed somewhere in there who knew. It would have been intolerable to know I have cancer and not tell other people.
I see. Yeah. Okay. Yeah.
I got this rock. So on screen, some people might see this. It says "Be brave." After learning of cancer, I met with a nurse navigator, and they have a program where people will donate rocks, paint them for women to hold during chemo or radiation. And I saw this one, and this was it. And so I held this through the funeral. Really made a difference.
One thing interesting about you, talking to you about this, is having talked for hours with Seth, when he was telling about how he coped with things, is that he struck me, though I don't know him like you know him, but he struck me as a person who you would probably not say is highly temperamental, highly emotional, even though he really understood emotions and was really good at these things. But, you're an emotional human being. You're like, clearly, it's all over you. It's on your face. I mean, I can tell when I sit here and start to tear up. You're an emotional human being, and you create emotion in other people, and you're a highly sensitive human being, and then you choose to go there. So it is the bravery rock. I understand. I mean, it really means that it's different for different people to cope with these kind of decisions, right? I mean, you can't just count on your temperament to dampen everything.
I think that's, parallels my experience with DBT before and after cancer. Something that Marcia came up with and wrote about, and that Seth really taught me is, there's nothing wrong with being sensitive or reactive.
Right.
It's a problem when it's a mismatch with the environment, with reality, with the goals of the situation.
Mm-hmm.
And DBT isn't about taking an emotionally vulnerable person, a sensitive person, and making them cool and calm, cool as a cucumber in a bowl of hot sauce, as the
Right.
Beastie Boys say. It's about being, I've taken it that way, and that's why I think it's a lifestyle, not a treatment, of being my Andrea self, being my emotional self, and having skills to regulate those emotions when it's effective to regulate them, and actually not regulate them when it's not effective, and let them, I guess, well, it's kind of a paradox because it's letting them be without decreasing them. But a lot of times when it's a primary emotion, an emotion that's prompted by the situation, letting it be and letting it run its natural course, you're not damping it down, but that's actually what helps regulation in a bigger picture, in a long-term way. So I knew for me, when I had this, I was going to war with cancer. I knew my vulnerability was already high, having just lost Seth. My husband being an ER doctor, really facing burnout after 2 years of a pandemic. That was something I was actively working on, reducing vulnerability related to our family. I would need to do this even more. It was clear, the doctor said, this is going to be at least a year of really intense treatment, and maybe more than that, but at least that. And that part of what I need to do is feel my feelings now, because if I didn't, they would blow me over like a jack in the box, right? If I kept it closed, bam, it would knock me over. But I wanted to keep that open. And to take some time of feeling them and crying, and then taking some time to get space from them too.
And also having 2 young children while you're going through all of this. You're describing a complete, all-out package of how to cope with something, but actually you also had a 6-year-old and a 2-year-old.
Yep. I remember those first, it was from January 26th through January 26th through February, I think it was February 9th. I did not know if I had stage 4 metastatic cancer. So I had gotten the initial biopsy, found out 2 days later on Friday it was grade 3. So there's 3 grades. 3 is the worst, most aggressive. I found out it was HER2 positive, which is about 20% of all breast cancers, and it used to be a death sentence. So it's a remarkable area of science where it used to be really untreatable and has flipped with personalized medicine, targeted medicine that is quite effective, but it is more aggressive and faster growing. I had learned I had lymphovascular invasion, and then the next week I had a lymph node biopsy that it had spread there. And then the next step is it's spreading throughout your body. And I remember driving my girls to school in the morning and tears coming, and just not knowing how I could handle this. And what really got me is there was the sadness and fear that came with what I actually knew. There was also a lot of guilt that I was surprised by. And that had to do with I should have known. I should have gotten this checked out sooner. I waited 6 years. This could have, thinking about that, and the guilt of what if I leave Chris with the girls alone. And
Mm.
then it hit me. I had gotten I had worked on practicing mindfulness and really my participate skill of being in the moment, participating in what I was doing, playing with the girls. And then one day it hit me, holy fucking shit, Charlie isn't old enough to have her own memories. And if this is metastatic, I could die before she has her own memories of me. And then it made it aversive to be around her. And so I went into high gear of leaning on my skills. I mobilized using Dear Man, Give, and Fast, making calls, doing appointments, being quite assertive, like 10 out of 10 assertive. And I think I switched hospitals also, and I think I got things moved up to start treatment in 2.5 weeks in what otherwise would have been at least 3 months. So that helped to solve the problems I could and to tell people. So in those early days, I was telling between one and 5 people a day. And for me, that was kind of like imaginal exposure for PTSD of facing it, telling it, feeling the feelings. Mm-hmm. And so that gave me comfort to lean on those skills during that time while feeling terror.
It just seems like it's that while this is all about who you are to have done this, and you already had these skills on board, thank God, because it sounds like you really leaned heavily on these different ways of coping that, you learned having nothing to do with cancer.
Right.
But then you had them kind of in your back pocket, so to speak, and sounds like you're just using them. But one of the skills that you had, and I don't know if it's better or worse, it's probably a positive skill, is that in a way, if you see cancer in front of you, if cancer's an enemy, you charged into it. You didn't wait for it to come to you and, let's begin this 3 months later. Let's begin this as soon as we can. I mean, that's not necessarily what everybody would do, right? I mean, you're like, let's do this. Let's find out about this. Let's do this now. And then you're faulting yourself for not finding out about it sooner, even though you had actually been checked out by doctors back there, you said, in 2016. So it wasn't only you that didn't follow up on it. You actually were evaluated. It just nobody seemed to sound the alarm bells at that stage.
I think my mind kept going back to the past, the should haves, especially before I knew it was stage 3 and not stage 4. And what kept coming to mind is mindfulness is this moment forward. What can I do now? I can't change the past. I can't have gotten this checked out sooner, but I can do this now. And so I kind of went into hyperspeed with that. And I think that if it were on the cusp, like that, those weeks, you can't know if they meant something medically, but it did to me. I think of, I used a lot the DBT for solutions to any problem: solve it, change how you feel, tolerate or accept, stay miserable. And one thing in that early time, I remember talking to one of my former trainees, and she was like, "You're not choosing misery." And so it took for me observing and describing what was a misery response for me, and then making a mindful choice to do a skill instead. I definitely went into misery mode at times, and then it was taking my mind out of it and doing what worked.
Also what embedded in what you're saying, but you aren't using the term, but I know you know it and probably thought of it 1,000 times, was you really moved forward into the treatment aggressively, having radically accepted that it was there, having radically accepted that, okay, something's going to have to be done. I better charge into it. I don't know if it's going to make a difference to charge into it or wait for it to come to me, but I'm going to. So there had to be a sense. It's on my mind partly, Andrea, because just in my DBT skills group, just last night we spent the entire time on radical acceptance and with lots of very poignant examples. And it makes such a difference if you actually just accept the reality of what you're going to have to cope with. It sort of brings you to the starting line, you might say, in a race. Like, okay, we're going to do this race, or it puts you in the roller coaster where you're putting your seatbelt on and saying, okay, here we go.
One thing that's interesting is there's different parts of hell realities that can be hard to accept, even if it's the same thing. And that I think that has to do with our own learning histories, our own temperaments, the supports we have in the moment. The having cancer one, it was, I had to use skills. It didn't just happen that I accepted it. It came relatively easy, but I did it again and again and again. The part that I didn't really accept at that time was the uncertainty. So there was the having it and the choosing treatment. The way I got there really was the letting myself cry, letting myself feel, and what I said about the exposure of telling people. It really, I love a 2-for-1 sale, like when you go shopping, and I love 2-for-1 skills, where it both was that emotional experiencing and exposure with telling people and helping me accept, like, this is my reality. I have cancer, which there were so many times where Chris and I were like, wait, what? I have cancer? Like, this makes no sense. There were times where we'd forget and we'd say, like, I wish this was a dream. I remember thinking we had gotten in a bit of a fight a couple of days before cancer because we were having a really hard time with bedtime with Olive. Like, as an exposure therapist, you know everything to do with your kid with bedtime, and then when you're a parent, like, it's impossible to do.
Right.
And we were really stressed out because she was kind of being a nightmare with bedtime. And I remember thinking, wow, I wish I could go back to being stressed out about that. I wish I could go back to that being the thing, And so it was again and again. And it was building my army, my supports, my village by pulling people in. So I got that 2-for-1. Where I wasn't accepting was this may or may not be stage 4. This may or may not kill me. I don't know how much time I'll have to live. And my mind, my version of radical non-acceptance wasn't the denial. It was going towards the worst possible outcome. And thinking the predictable bad thing is going to happen versus the uncertainty. So
you were settling the uncertainty in your mind by going to the bad option.
Yep.
Like assuming the worst and
Exactly.
then preparing for that, which might be itself a useful skill, but it isn't the same as radical acceptance of because the fact is you didn't know. The fact is there was a period of time there where you were hovering in between a biopsy and not knowing what stage you were at. Yep. I assume that also not just biopsy, but you must have had scans and things at that point.
Right. I was waiting for the metastatic workup to have a CT scan and a bone scan, and going to the worst possible situation brought down, you think it causes suffering, but it also gives you some relief from the uncertainty, and it's not effective. And so I had to work on that actively. And I think that comes up a lot with anxiety.
Yeah. Wow. That's so interesting. Wow. So what did you find out? So tell us the next step.
So on February 4th, I met my dream team of doctors at Dana-Farber, and my doctor, my oncologist, specializes in HER2 cancer, and she made it clear, we've got treatments, like, very clearly hopeful, positive. She had shared that they're going to do chemo first as a way to test out if it works before surgery. So the clinical trials say 65% of women will respond to chemo and have what's called a pathologic complete response, where the cancer is gone. She knocked me down to 50% because of my age and staging. So talk about an uncertainty exposure. It was really 50-50. And, what's really helped me is labeling skills opportunities. So lemonade out of lemons, and thinking like, well, this is going to be the hardest uncertainty exposure I've done. And going into this treatment knowing it may or may not be effective. I completed this first leg of treatment. Actually, I'm calling it today, is the day that I completed my chemo. So it was 6 cycles, And each cycle is 3 weeks. And that 3 weeks ends today. And so
Wow.
at cancer centers, a lot of them have bells, like chemo radiation bells that patients ring to celebrate the end of their treatment.
Mm.
Some hospitals don't. And the reason I asked, you would think it's like a nice thing, a celebratory thing. I had asked my team if they had one, and they said, it's nice for some people, but for other people, they don't get to ring the bell. Or a treatment doesn't work, and it brings up stuff for them, and that's why they don't do it. And so dialectics has been such an important part of my coping and my treatment, and being able to see that there are these two sides, that the bell is good and bad. And so I like that they didn't have it. And I have been planning, rather than ringing the bell on June 3rd, which was my last infusion day, I'm choosing to ring it today. And I'd like to do that right now, if that's okay with you.
Oh, I was just going to say, let's do this.
I got a bell right here.
Oh my God. So touching.
So I would say over the past 18 weeks, I had diarrhea maybe 80% of these days, and nausea and bone pain and steroid hell. And I walked through hell. And I'm proud of ringing this bell. I won't, 50-50 chance it got rid of the cancer's still there. I'll know in a couple of weeks, but no matter what happens with that, I get to ring this bell for doing it. And that's something I'm proud of.
Yeah. Please do. Mm. Oh my God. It's so touching. I feel like I'm relating to a 38-year-old woman, and I'm relating to a 6-year-old girl who's just proud and pleased that she was able to dive into that swimming pool when it's so frightening. And it's sort of what you've been through is just so much goes into ringing that bell. It's just a little hard. It's hard even to sit here and just sort of calmly tolerate this. I have a bell. You can see it above my head.
I do.
A large one. I thought, well, should I get my bell out? But I thought, no, this is your bell. This is not my bell. I thought, should I join you with that? And it's, no, this is in a way, you have, like you said, you have Andrea's army. You called it. I love that. It's your sort of social support system. And you've cultivated it, and you've used it, and people have stuck with you. But it's also a solo journey, right? I mean, no matter how good that army is, there's always just you going to sleep at night thinking your last thoughts of the day about what you're going through. Tough.
I think it's interesting because DBT, talks about DBT as a treatment of a community of therapists treating a community of clients, and there is really that team aspect. And I think that's something, as an affiliative person, I loved about the treatment and have made my lifestyle. And so having my medical team and really, one thing I haven't said on here is that I've been journaling as a way of coping and writing. And so I have a Caring Bridge account. I just hit, I think, 113 posts, and so writing and expressing has been really important. Really feeling like I have brought in people in different ways that match our relationship and who they are to get through this. And there are times where through this, I've never felt so connected with, getting packages and phone calls and things that really mean a lot, and then never so alone, because nobody really can understand what it feels like. And I think with fear in particular is the place that feels so alone.
Just coming face to face with the fear that you won't make it.
Yep.
And the fear that your daughter Charlie won't remember. I mean,
Yes.
Those kind of fears are really just hard to face. What do you do about them? How do you face those fears? How do you respond? I don't even know how to ask the question, but I think it's very important, because You're a very skillful person.
So I honestly don't remember if this conversation happened before or after I found out it wasn't metastatic, which, by the way, is a little bit, it's meaningful and it's not, right? Because I know that right now there's not evidence of the cancer having spread beyond my lymph nodes. Imaging isn't perfect. It possibly could, and it could come back. I mean, that's the other thing, is that right now I'm focused on the war that I'm in to get cancer free. And I know that there's going to be fear beyond this. My Aunt Debbie is a breast cancer survivor and had one recurrence, and she's been reading my journal, and it's been so cool to see her connect with DBT. I don't think she would have had any reason to really connect with it, outside in her life, and saying how these things relate and give her tools, where right now she has no evidence of disease. She's not doing active treatment, and the fear is there. And so I think there's different stages of cancer, but the same thing can relate to other just hells that everybody goes through too.
Right. Right.
So I had this conversation with Alan Frazzetti, who many listeners will know as a DBT hero, and shared with him just how the things about not being there for Charlie, and talking about how the worrying doesn't help. Like, our minds, I think, often have us worry or think of the worst case scenario to get some relief, and that, I guess really me wanting to be there for her and knowing I can't, and kind of him reflecting back, like, what you can do is be in the moment with her, be with her now, and hopefully this won't happen where you're not there, and we can only expect and hope that her having this time with you now is going to do her well, in the long term for when it happens. And it was so clear to me, as much as it was painful and scary to be at Seth's funeral, seeing the amount of life in these years since his diagnosis, and his only having been 51 years alive, is more than I imagine most people live in 100 years. And so I think mindfulness is this moment forward, and mindfulness of being in this moment. So it's scary. It's really fucking scary. And I think it's the looking back, thinking about how I want to live my life no matter what happens. And that's being here now.
I like what Alan said to you, and also I just think the idea that Charlie wouldn't remember you at a certain point in time later is very much of a concept. It's a concept. It isn't reality, and it might happen. It might not. It might not take. It definitely won't take the form you're thinking of it. It just never will, because it's more complicated than that. But it's also just as true that even if you passed away today, it's unforgettable. The impact you've made yesterday and today, and with her and with the people around her, that'll continue if that were to happen. But it's also just so much a concept that this, again, I feel in the pressure in the conversation that comes from the intolerance of uncertainty. It's sort of like it's just part of what adds to the suffering is, of course it's going to be the worst outcome. Let me think of all of the worst things that are going to happen. And it's just sort of like, you just don't know. It's just so uncertain what's going to happen to you and what's going to happen actually to me in the next day even. But it's the uncertainty is just really hard to bear. So could you, I want to, because I'm also identifying with the people who might be listening to this whenever they listen. You kept using a term, her too. Mm-hmm. Can you explain what you mean by that? Because most people probably wouldn't know.
Yeah, so breast cancer has different types. And So there are three different receptors that they test for when they detect breast cancer. So one is estrogen, one is progesterone, and the other is HER2. And so you can be any constellation of positive or negative for the three. And so I'm negative for both of the the estrogen, progesterone hormones, and then positive for HER2.
I see.
And what that allows is medicine, it's biologic medicine, targeted therapy to chemo really goes after the whole body. And that's why we have these really horrible side effects. And HER2 is more targeted just to the HER2 cells. And so that treatment didn't exist before, which made this such a deadly kind of cancer to have. And now that we have it, there are better outcomes. And I lost my train of thought. There's a little bit of chemo brain still happening. So I will be on this treatment for HER2 over the next year at a minimum every 3 weeks. And if the cancer is still there, I'll need some more chemo after surgery. And that's what we'll find out in a few weeks.
I want to ask you something that came up in a conversation you and I had before this podcast. I mean, last week or a couple of days ago, whatever it was, you and I last talked. You mentioned something that had not occurred to me before, how it would be that when you tell other people you have breast cancer,
yes.
that because that's the most common cancer for women to have, that you'll get certain kinds of responses that are well-intended, but that don't go very well for you, right? And I just wanted you to have a chance to say something about it. I thought it was really important aspect of how you can.
That up. Yeah, so I think just about everyone knows somebody with breast cancer. It's very, very common. And so when I told people, folks were it was clearly coming from a good place. The intention was there to be loving. And it was what we sometimes call like an error of compassion, where it was actually could be hurtful. I would share my experience. Naturally, hearing that would bring up negative emotions, and people would say, "Oh, I know so and so who has breast cancer. You should talk to them." Or someone had this, and what I felt was, yeah, but their experience isn't mine, and either it was a stage 1, a stage 0, and it felt like, oh my gosh, I'm so jealous of them. I wish I just had a lumpectomy. Like, that's nothing like what I would have. Or if it was metastatic or they passed away, it's like, I don't need to hear this right now. And so it's the comparisons. And so I think where people were coming from is whenever there's distress, our brains, I think, naturally want us to reduce the distress, and problem solving is a way to do that. That actually ended up feeling invalidating to me. I actually wanted somebody to just kind of join me, to explore, to understand, to ask questions about my experience rather than giving me a solution that actually I wasn't looking for. And this is something that I think I was very attuned to and could put the label on because I work with adolescents with anxiety disorders and emotion dysregulation. And in coaching parents on validation and invalidation, going right to problem solving and trying to fix it, often people experience as invalidating, whether or not you're a super sensor, but especially if you are. And so I kind of over time reflected on that and realized it's a comparison. That's the thing that's setting me off. And judgments are comparisons are judgments. And we lose information. And so that was something I think just having that language and understanding where this was coming from, how it affected me, helped me let go of suffering. Because at first I was like so annoyed by it. And I think the other piece is people, I think, tend to make assumptions that breast cancer is this one thing. But you've got the different grades, you've got the hormone receptors, the HER2 has it spread, and very different treatments. And so I see that a lot. I'm in a bunch of support groups and people feeling invalidated in these different ways. So it was almost like, in mental health, somebody finding out someone had, severe OCD, and somebody saying, oh, but I know this person who has depression, thinking it's like mental illness is one thing. And, that metaphor helped for me.
So in a way, if you were to, not that this happens this way, but if you were to say to somebody, if somebody said to you, all right, now that I hear that you have breast cancer and that you're in treatment for that, um, how should I behave? What's the best way for me to behave? I have a feeling you would be saying something quite simple, like, well, just be curious and listen to me. You know, not come up with a solution, not say the right thing, not validate me in the correct way. You know, like just put that all down and just be there.
Yes.
Just be there. You know, like Thich Nhat Hanh would teach, darling, I am here for you. That's it. And then it goes from there. But what you're saying, in a way, is complicated, but it's also very simple. And yet we often rush past it. I mean, people rush past because they're anxious and they want to be helpful and they don't know what to say, right?
Exactly. Being with me, which I realize is asking the person to tolerate their own distress, to feel their own distress, and that's a big ask. I would say yes and to what you said, Charlie, everything you said, and I think the not telling people to correctly validate or be afraid of saying this one thing. What I had this conversation with dozens and dozens of people was like, hey, I don't know how to talk about cancer either. Like, just because I have cancer doesn't mean I know how to do this. We're going to make mistakes. I want you to know, like, I'm not expecting you to say the right thing or the wrong thing. I want you to trust me. My commitment is to observe the impact it has on me. And if it doesn't work for me or it hurts me, I'll tell you. And so I'm asking you to be willing to, quote unquote, make mistakes. Like, I don't even know if it is a mistake or, not walk on eggshells.
Yeah.
Because I think whenever anyone's trying, especially in an emotional situation, to say or do the right thing, like that's just it creates too much tension, and the walking on eggshells ends up being invalidating or hurting. And so, like, we're gonna do this together. We're gonna figure this out together. Is a big part of it.
You know, one thing I also wanted to get to based on a previous conversation was you may or not remember it this way, but my mind categorized what we wanted to get to, and we're not going to get to all of it today. But one was kind of the various ways that you've coped with skills, how you've coped with skills, and you highlighted some skills like mindfulness skills and being dialectical and using cope ahead and using acting opposite, these various skills that some people listening might have heard of, some people listening might not have heard of. There's that whole category of things, which is huge. I mean, actually, when I've read your journal, I think I wrote back to you at one point just saying, basically you're writing a book on DBT skills. I mean, it's like everything. And it's just incredible. The second category was your army, the sort of your social support army, and how that has worked for you. And the third had to do with wise mind and more of a spiritual path. And I wonder if I consider us to have about another 10 minutes or so, and I wonder if you can, choose. You can't comment on everything, and I'll tell people who are listening, if you want to hear more, we are going to sit down again in a follow-up podcast to this within a month. I think we named a couple possible dates in July, so you can follow up. But let's just use the rest of the time and comment on what you want to say to people so they can kind of hear how you've been coming to grips.
I think I'll speak about wise mind. Because we haven't really talked about that one so much. So I see leaning on my skills, the various skills, the people, and then maybe this goes to what you were saying, Charlie, about, well, you have this village and people, you are the one ringing the bell, you are doing this. I think knowing I have kind of this wise mind of mine, to both lean on other people and lean on myself. And getting to wise mind as a place where I have emotions that are, valid emotions and reason, and I can kind of think and speak and problem solve at the same time. And I remember, teaching different people about Wise Mind over the years, and people like being surprised to hear you can cry in Wise Mind. I think sometimes people will mistake Wise Mind for Reasonable Mind, but being able to have a space where there's both, that's both intuitive and just knowing intuitively, like a gut sense, but also based on your experience. And so it's been really helpful for me to have leaned on skills through other versions of hell before this, know they can support me, know what works, and being able to like learn from it and adjust and put that into action here, and being able to take kind of chances. And so I think I've gotten I think there have been times where I really, really want to be in Wise Mind and can't. That has caused some extra frustration. And times where I'm like, I know I'm here, I'm doing this, and I've noticed not suffering even though pain is incredibly high. One of the things I learned from Seth early on is you've got distress, so 0 to 10 distress. You've also got distress tolerance, or your ability to tolerate distress. They're often correlated, but they don't have to be. So I, had used this myself before with clients, with friends that I'm coaching, that you can be at a 10 out of 10 distress, and you can be at a 10 out of 10 distress tolerance. And so I think I've been on medical leave. I want to name, I've been really privileged and fortunate that our family can do this while I'm on medical leave. And so I've been treating this as a kind of all-in thing, that not everyone has that opportunity. Mm-hmm. But doing things are like kind of all around to bring up my ability to tolerate distress. And so I would say humor is a big part of that, and silliness and games. Like, I think finding little rituals or routines to go with the cancer treatment to celebrate when it's actually a really hard, shitty experience, like being able to have both and allow yourself to have that can be really hard. I think guilt and shame can make that hard, and it's really helped me. My friend Susanna said, you're sucking the joy out of like all of this experience. So I think thinking about whether it's with cancer or any other hell, that there can be both high distress and high distress tolerance, and living life even with pain. And I think that goes in hand with me getting to my Wise Mind to make choices too.
What role has you mentioned something that you've gotten into more, which is gardening. What has gardening done for you?
Several functions. So another 2-for-1 sale here. It was interesting. Right when I got my diagnosis, people sent cut flowers, which I hated. I had this aversive response. I didn't want anything that was going to die. I remember that. I don't really have much words or reason to it. And then I told people, I thanked them, and I appreciate the ones I got. But I said, like, if people ask me, I was like, you can get me a plant. I don't want cut flowers. I remember feeling that. Being able to not know how long I'll live, and know it may be shorter than I would prefer, or what I would want for myself and my family, and to still live and put in roots in the ground, is really accepting the reality, living as if I am going to live, or living as if I'm living now. And buying clothes was another example of, or buying things for myself was hard, and I knew this was a way of practicing accepting reality, that I don't know, which isn't that I am going to die, but I may or may not die from cancer. Humor helped. My husband would joke that you're going to live to see all of Olive's 6 grandchildren, like joke, or her children, not her grandchildren. I won't live that one. Her children. In the cancer community, amongst providers and some patients, some people cope with all in positivity, and that there's no room for anything that's totally positive. That doesn't work for me. I'm not judging it as bad. If it works for other people, great. But what's effective or not, like, that isn't it for me, because it misses, it's not dialectical.
I like the point that you're making there, because a lot, like that came up at the beginning of this podcast, there's characteristics about you that are not like everybody else. You have you're a uniquely you have a unique nervous system, in my opinion. I mean, you're very sensitive. You can even tell talking to you. I mean, you pick things up instantly. You have strong reactions to things. You have you've called yourself, when you talked to me before, a super sensor, and I know what you mean. And then you're also somebody who feels things passionately, and you're also somebody who, for whatever reason it's been in your life, you're the kind of person who goes all in on things, and that's clear. And you've gone all in on this and on DBT and in your relationships with people. You put all of that together, you're going to have a very different way than the person who, like I've known people who are just like what you just mentioned, that don't want to hear anything other than a positive statement. Like all you have to do is have one phrase within a sentence that's not totally positive, and the person's like, could we please stay away from that? And that's the way they're coping, and their nervous system needs to cope that way, at least for the time being. There's just, I love the way you're telling this, because it really, you're owning your own unique journey here, as opposed to what other people ought to do.
This brings it back to Wise Mind too, and what I wanted to kind of name as important is, in DBT we talk about effectiveness as a mindfulness skill of doing what works in the reality you're in, and you've got to observe and describe reality to know that. And so, I don't think there is a what to say to somebody who has cancer or how to cope, be all positive or don't, but it takes that mindfulness to know in your wise mind, what are your values, what are your needs, what are your sensitivities, and then figure out what's effective from there. And so spending time from one wise mind to know that is important. And I think that's something I did before cancer, but this extra pressure and, being in this crisis mode, I think I've taken that from the experience. So I certainly can be very positive. Like I will say, I'm going to take more from cancer than it's taking from me. I'm going to enjoy the lemonade that comes. And I see polarizations don't work for me.
That's the last thing I want to ask you just before we stop, and we can expand on this at another time, is I guess I'm thinking back to a different podcast I did that you probably heard with another very inspiring person who lost her child at age 2.
I did not listen to that one. I will say that. I had a 2-year-old
You never did.
at the time, and I avoided. It was too hard. I do know a little bit about the story. I'll hear it at some point, but it's choosing, when it's effective to do something, and at the time it wasn't.
No, that's very. I understand that. And but one of the things I learned talking to her is she had very many characteristics like you, I would say, without overgeneralizing, but it's sort of on the spectrum of human beings, and how passionately they face what's coming and open and try to cope with it, as opposed to suppress things or push away. She's very much on the all-in, open, do what she could, and it was very inspiring to hear how she coped with it. But she also described that her husband didn't have that style, and yet they were a couple going through something together. And of course, you are a couple going through something together, you and your husband Chris. And I just wonder if you can say a little about how your style and his style fit together, on what does he do and how does that fit with you? Because that's another thing, managing cancer is managing the person you live with, the person you love, the person who's your husband in this case. Like, what do you do and how does he do this?
I like you naming that, because it also acknowledges, transactions and systems, and that I'm not in isolation, and we're together as a family. So Chris is an introvert, which is really interesting that we're opposites in that way. And I think in many ways, I feel like how I've coped with my cancer has been what I did before cancer, and then, and like full force. For him, I think he's needed to cope in a different way than he would have before. And that for him was that open vulnerability part. He's a private guy. He's a physician, and I think physicians are not necessarily as open with things. And he realized to get through this, we're going to need support. We're going to need flexibility. And so I think he was incredibly brave by telling his colleagues and accepting support in that way. I think there's factors of also gender roles in accepting help too, where I think I admire him for it. And I think it's great to show our family. I think that there's ways in which, of course, it's harder on me as the one with cancer, but I think there's some ways in which it's harder on him because he is still working his full-time job. He's not necessarily getting the same support that I am as being the one who's the patient, and our temperaments are different. And so I think for him, he's acknowledging really the chronic stress of it and needing to do what works for him. So for him, working out, he has this incredible personal trainer named Forrest, who I really like, that it's the physical exercise for Chris, and it helps his mood, and that's how he gets through it. Whereas I'd rather be with someone talking or doing things, and he's working out, and that's what he needs. And if he misses it, it has an impact. So it's not right, neither one is right or wrong, but that's what works for him.
And then this is a bigger conversation. Actually, I'm going to be doing the next podcast that will be posted after this one is going to be really trying to discuss what does it mean to be dialectical, and what does it mean to live dialectically in your relationships and things, which I think everybody in DBT sort of knows this term and knows it's important and has an explanation for it. But I don't think I don't think most of us fully grasp how important it is. And I think that what you just described is, one of the definition of dialectic is the unification of opposites, and finding a synthesis between opposites. And so you and Chris are going through something together and separately, and in some opposite ways. And you're talking about joining around, I guess one synthesis is you're both very vulnerable, and he's learning to accept help is part of that for him, which is maybe not his normal mode.
And I think it speaks to, I think we should talk more about dialectics in the next one, like make a point to do that. Just briefly, I know we have to stop now. I think it helps to think of, you ask people when they first learn dialectics, okay, if the two opposites are red and blue, what's a dialectic? And most common answer you get is purple. And it's not, because purple is a watered down version of red or blue. So I like to think about it as a plaid where if you look closely at a plaid, you've got red and blue both there. You've got something that looks purple and something that's all together like different. And for Chris, for him and I to have kind of introvert, kind of extrovert time, we're not helping each other. And so we kind of will plan, we joke in like a cheesy way, like, what do you need for your wellness today? Like that's a cheesy way of saying it. And he's like, I got to work out, which is exactly the opposite of my coping need of wanting to go to the PVD flea market, and to be together or go swimming with the girls. And so it's a matter of how do we get both and see who needs what on a given day. And so that's something I think we've always needed to navigate, and the extra vulnerability makes it more challenging.
Right. How do you preserve his introvertedness, and how do you preserve your extrovertedness without having to water them down, and still be supportive of each other? So, hey, Andrea, like I've said, we're going to continue this conversation, and you're probably going to, and it'll be after you're at a different point, even though it's very soon, about your sort of medical situation. So that'll factor in too, but we can also continue to pick up on what we were talking about here, that obviously there's about 400 loose ends that we could follow up on more, and I look forward to that. So thank you so much for being willing to do this. I think I don't mean this for me personally. I mean, I'm thinking of all of the people who are going to listen to this in the future, some of whom are one way or another, their lives are touched with cancer. Yes. And so it's just such an important topic. So thank you for coming in and being so personal and so smart and so thoughtful about sharing what you've shared.
Truly a pleasure. Thank you, Charlie.